Back on MorningLine on this Wednesday. This is Clint Kelly's malpractice attorney here in town. His office in Hendersonville. It's good to have you on, sir, as always. We can take your phone calls, 737-7587. We had one caller just wondering, I wanted to clarify for you about cases you take. It's the case. You decide whether to take the case based on the merits of the case, not the individual, obviously.
That's correct.
It could be anyone that walks in, color, creed, race, sex, whatever. That doesn't matter to you at all. It all comes down to whether or not you think that case is legit.
Exactly, and you can take some of the what might seem some of the most strange cases ever. You know, like those cases with the men's clinic.
Oh yeah.
Those were maybe some of those were probably two of the strangest cases I've ever had. But it was clear there was medical negligence, and you know, both men were impotent and went through hell. So I take any kind of case where there is negligence and there's severe, permanent, devastating injury, and there was in both of those cases.
Let's go to Walter. Walter, good morning. Oh, I'm sorry, not Walter. Ernie. Ernie, good morning.
Good morning.
Hey, Ernie, go ahead.
Well, sir, I just want to talk about a thing that happened to me. Back in May, I fell off of a lawnmower, threw me off the back of it. I went to the emergency room and told the doctor what had happened. And he sat across the room, and he said, "You probably just bruised some ribs and muscles." He said it'll take time to get over it. So he said, my suggestion is get some ibuprofen, and he said it does take time again to get over it. So I did what he said. He didn't lift my shirt up to see if I was bruised or anything, feel of me to see if I was hurt. Or anyway, excuse me, but he didn't lift my shirt up. I was bruised. My back was bruised, and I waited for 5 weeks, suffered lace out of my back all of May, and then I went to my primary care doctor. He asked me. I told him what happened. He said, "Did the emergency room doctor give you an X-ray?" And I said, "No, sir." He said that's the first thing he should have did. So he sent me around and got an X-ray, and come back and told me my back was fractured. So then on the 10th, I went and got a CT scan, and it was my back was sure enough fractured. And I suffered for 5 weeks, and the emergency room doctor didn't do anything, like I say. And he could have did something, and he didn't. He didn't, like I say, didn't even raise my shirt up to see if I was bruised. My back was bruised, and like I say, I suffered for 5 weeks. And they say that he didn't do anything wrong.
And who says that?
The hospital. Well, the attorney there. I talked to the attorney there. That's there now, and they investigated it and said there wasn't nothing that could be done. That they wouldn't know. They didn't see no malpractice.
Oh, and that was. You're telling me the hospital that did this to you said there was nothing wrong, and their attorney said there was nothing wrong.
Right.
Okay. Of course they're
going to tell you that, Ernie.
He did not even check me out. He just get up out of his chair. He just assumed that all I did was bruise some ribs and bruise some muscles, and he said take some ibuprofen.
All right.
Let's talk about that.
Yeah, you can ask him some questions. Clint's got some questions for you.
That's right.
Okay, listen up here. He's got some questions for you. Okay, Clint.
Yeah, Ernie, you going to make a full recovery?
Will you recover, Ernie, or what's your status of your health now?
I'm still recovering from it.
Okay.
It didn't happen on the 10th.
May?
Or
Okay.
the 8th of May is when it happened.
All right. You know, Nick, Ernie did the right thing by calling in. That's exactly what people are supposed to do, and he knows. He's smart enough to know, and his intuition tells him that he's been dealt wrong in the emergency room. Now, the problem with Ernie's situation is, and it's a problem basically for a lot of different patients, is when it comes to medical malpractice, he's going to recover, and that's a great thing for him physically. I mean, that's what you want. But because of that, he's not going to have damages sufficient enough to bring a case.
Okay.
Now, don't ever listen to what the hospital lawyer tells you. If you go to administration and try to work a claim out, you're not going to get what you want. You have to get a lawyer representing you. Otherwise, basically, you're going to be told by the other side you have no case and not going to get any relief that way.
Well, let me check one thing with Ernie. So, Ernie, while you're recovering, do they anticipate that you'll have any problems with your back, years from now, or do they expect you'll fully recover, or do they not know for sure?
Well, they didn't say.
Okay.
Happened, like I said, it happened in May, and my back still gives me problems.
Do you have any paralysis or any problems with your legs because of this or anything like that, or is it just pain?
It's pain.
Okay, all right. So, and how old are you, if you don't mind my asking?
Well, I just would not say that.
Okay, but you're not a spring chicken.
Right.
Okay, fair enough. Yeah, I hear what you're saying. And now, again, because I was going to ask you, it appears to me it certainly meets one of the criteria. It doesn't look like that emergency room doctor, for whatever reason, he may have been very busy, I'm not trying to make excuses for him, followed up with the standard level of care. You have an elderly man comes in who says he took a bad fall, complaining of a lot of pain in his back, doesn't even look at him, says take 2 ibuprofen, call me in the morning. I mean, if that's standard care, I think there's a problem with that. I mean, without even looking. So it appears to me he didn't get the standard of care there.
Right. So you're looking at it now. You've been doing this long enough. You can analyze the case.
Okay, that
very
part
much
I know.
You know
Now, you know the other part.
3 elements. So you've got number 1, which appears to be a negligent act or a violation of the standard of care. But the second thing is, did that cause Ernie to suffer an injury which would not otherwise have occurred? In other words,
Okay.
did this negligence make him worse than he otherwise would be? I can't really tell. It looks to me like he just didn't get the relief he deserved. And then the third part of the damages. Pain obviously is damage, but how bad is that pain going to be, and how long is that pain going to last?
Right.
The injury he's describing sounds like something that's going to be a temporary situation, which, like I said, is good for him.
Mm-hmm.
What would be potentially a malpractice case would be, what if he were paralyzed?
Yeah.
Or as you said, what if he had some major nerve damage that was not diagnosed because the back was ignored?
Or, like, for instance, it got worse. Like, yeah, they said,
Correct.
don't take the ibuprofen. He went home. Then he was okay. Next morning, he wakes up and his legs aren't moving because he slept awkwardly, and the crack pressured the spine, and now he's paralyzed.
Yeah,
Now,
let me
that's,
give you another example,
Okay.
Nick, of a patient who came in with back pain, went to Vanderbilt, and was misdiagnosed because he ended up having a spinal epidural infection that was putting pressure on his spinal cord. And as a result of the failure to diagnose that, he's paralyzed in a wheelchair today. And so that's one of those situations where, you know, a failure to diagnose back pain can be devastating for the patient if it involves spinal cord action, and that justifies a medical negligence case.
Okay, you know, you've talked to me about other cases, and Ernie, so I hope that's clear. I'm so sorry that happened to you, but it doesn't appear as though you have an actionable case to go to court. You can file a complaint if you want, you know, about it
Right.
against the hospital, but you gave me an example once dealing with an emergency room where there was a misdiagnosis or something when a heart issue was in
Correct.
place, and they didn't do it, and the person left and either had a heart attack or died.
Very next day.
Next day, wait, what was that again, if you would? That always stuck with me, where they didn't do their diligence on the heart.
Yeah, a 37-year-old man who's
37.
overweight, who's high-risk smoker, went into an emergency room with chest pain. And a physician assistant, rather than a medical doctor, evaluated him and decided that he was having epigastric or indigestion. Gave him what they call GI cocktail, which basically is a numbing lidocaine agent that you drink, which will soothe the indigestion. He goes home. Next morning, wakes up, he's in his minivan with his wife pulling out of the driveway, and all of a sudden, you know, keels back, his
Widowmaker.
eyes go
Wow.
back, exactly, and he ended up having a fatal heart attack. And it was clear, and every ER knows this, if a patient comes in with chest pain, it is heart attack until proven otherwise.
And so, why do you imagine something like this happens? I've asked you that before. Is it an oversight? Is it they're too busy? Is it just raw negligence?
All three.
All three. I mean, it's just...
And sometimes you sit there and you scratch your head, how can this happen? How do these types of things happen? And it's for any one of those 3 reasons.
Okay. All right. I'm sorry, did we have caller on number 1 that I missed? Is there another call to take right now? Okay, I'm sorry. Yeah, but this IFB is breaking up, so yeah, just let's go to Charles. Hey, Charles.
Hello, yes.
Good morning.
Good morning.
What can we do to help you?
Back in April, I got a burn on my leg through a physical therapist, a masseuse. He sprayed biofreeze on my leg, and he put an ice pack for about an hour. And it resulted in having like 30-degree burns. So I went to Vanderbilt. I was at the burn clinic for about a month. But the insurance company, they want to sell it really quickly. And they keep expressing that I don't need an attorney. Should I get one anyways?
Well, wait, Charlie, what got sprayed on you? What was sprayed on you?
Biofreeze.
Biofreeze.
And plus he put an ice pack.
plus biofreeze with maybe like frostbite or something.
And what was the purpose of doing that? Why were you being sprayed?
I was having muscle cramps, and he told me that that's what he prescribed, the biofreeze and the ice pack.
And your skin had a bad reaction to the application of the biofreeze?
Well, when I went to the ER, they said the biofreeze and the ice pack together, it's sort of like a frostbite, and it burnt me like pretty bad.
Whereabouts on your legs?
My entire four leg, like the whole back of my leg, from my calf all the way down to my ankle.
What is the Vanderbilt burn unit? What's been the treatment there that you've had?
Every Friday I have to have my leg scraped.
Ugh. So are you gonna have permanent scarring, you think?
Yes. It's very. They said it would be very bad permanent scarring.
So if I saw you in a pair of shorts, I would recognize. I'd say, "Wow, that guy burnt his legs."
Yes, yes, definitely.
Hey, Charlie, I want you to call my office when you get done with this phone call, and the number is 615-824-3703, and you ask to speak to Pat, and I'll get in touch with you about this. This is really similar to that case we had, Nick, about a month ago with a patient who got cavicide sprayed into his arm.
Yeah, we'll touch on that too. Charlie, do you have a pen and paper near you right now, Charlie? We'll give the number out again.
Yes, I do. Go ahead and give it to me.
Okay, yeah, it's on the screen there, but go ahead, Clint.
Yeah, it's 615-824-3703.
Okay.
We'll talk about your case some more. You
Yes.
listen in, but yeah, definitely call Clint. If Clint wants to hear from you, it sounds like you might have a case.
Yeah, I mean, you should not have a burn that sends you to the burn unit from application of biofreeze and icing unless something was wrong in the way it was applied or he wasn't checked. I mean, that's a long time to be going to the burn unit.
Oh, yeah, and now they're scraping the legs, and this was just in April, so it's within the year statute of limitations. And as we go to the break, and we'll get into these two cases, the other one you talked about some of this crazy stuff that happens, when the insurance company representing the hospital or whatever says, let's just settle real quick, you don't need a lawyer, or the hospital tells you we did nothing wrong. Why on earth would you believe them? And I understand why you might, because we all tend to give hospitals and doctors the benefit of the doubt. We put them on a pedestal. They've been trained in a certain way. We trust them. But boy, don't.
Charlie's common sense kicked in.
Yeah,
and a lot of people's do. But even if you trust your physician, and you know, we all have to trust professionals. I do too.
Yeah.
But when something like this happens, when you're injured badly, and you know something's wrong and someone's trying to talk you out of getting a lawyer, that's when you get on the phone and you call a lawyer immediately.
That alone should be the red flag. And who knows, if they say they did nothing wrong, maybe as we look into it, they'll find out that that's the case. But at the very least, you owe it to yourself to check it out. We'll take a break. We'll come back, talk more about these cases. It's interesting. We can take more of your calls right there, folks. That's what we're talking about as you watch this program. I mean, Charlie was in a situation, wasn't sure.
Right.
He's watching, and this may be a case where he's entitled to some relief. The number 737-7587. Back with more right after this.